name is Miranda Adams, and I'm a family nurse practitioner student at Maryville University. Today I will be conducting my head-to-toe assessment video. This is Vanessa, and she has agreed to be my patient during this video. Before the assessment, I had Vanessa empty her bladder, and if we were in the proper clinical setting, I would also have her remove her clothing and put on a gown. I've also obtained a complete set of vital signs, including height and weight, as well as assess her near vision using the Rosenbaum chart and her far-sighted vision using the Snellen chart. Okay, Vanessa, I will first begin by doing a general inspection of your head and your face. I'm looking at your skin on your face. I'm making sure that your eyes and ears are nice and symmetrical, as well as your nose and your mouth. I'm then going to move on to your scalp and your skull. I'm going to palpate your scalp and skull. I'm making sure that it moves easily. I'm making sure that I don't feel any lumps or bumps. I'm also assessing the characteristics and texture of your hair, making sure that it's nice and soft and it's not brittle or dry. I'm then going to palpate your facial bones. Good, as well as your frontal sinuses and maxillary sinuses. Any pain or tenderness here?
No.
Good. I'm then going to move on to your temporomandibular joint. I want you to open and close your mouth. Good. And then move it side to side. Any pain there?
No.
Good. And there is no clicking or popping, which is a good sign. I'm now going to move on to cranial nerve number 5, which is the light sensation test. I want you to close your eyes and then let me know when you feel the sensation on your face.
Feel it, feel it, feel it, feel it, feel it, feel it.
Okay, good. And cranial nerve number 5 is intact. Now I'm going to move on to cranial nerve number 7. I'm going to have you go through a series of exercises. I want you to wrinkle your forehead for me. Good. And squeeze your eyes real tight. Good. Clench your teeth. Good. And smile real big. Good. Stick out your tongue. All right. And then puff out your cheeks. Okay, good. And cranial nerve 7 is also intact. I'm now going to move on to your eyes. I'm first looking for symmetry of your eyes, making sure they're nice and symmetrical. I'm looking at your eyebrows, and they're also symmetrical with even hair distribution. Your eyelashes extend upward and outward with also even distribution. Your eyelids are nice and symmetrical. There are no nodules noted. There's no rashes or lesions. Your sclera is nice and white. So your conjunctivi, they're nice and pink. I'm going to palpate your eyelids to be sure I feel no nodules, and I'm palpating for your lacrimal apparatus. Good. And now I'm going to move on to your pupillary response using my pen light. I'm going to have you look at an object behind you while I shine the light in your eye 2 times, looking for your direct response and then the consensual response. Okay. Direct response, consensual response, direct response, consensual response. Good. And so both your pupils were equal, round, and reacted to light and accommodation. I'm now going to do the cover and uncover test. I want you to cover your right eye. Good. And place it down. And then cover your left eye. Good. And place it down. And there is no strabismus or lateral movements noted. I'm now going to test your peripheral vision. I want you to cover your right eye for me. Let me know when you see my hands.
See it, see it, see it.
Okay. And do the same with your left eye.
See it, see it, see it.
Okay, good. I'm now going to assess your extraocular eye movements using my pen light. I want you to follow my pen light with only your eyes through the 6 cardinal fields of gaze. All right, very good. I'm now going to take my ophthalmoscope and I'm going to inspect your ray reflex. I'm going to inspect your right eye with my right eye, and then your left eye with my left eye. Turn it on and start at 0. Okay. Good. Move on to your left eye. Okay, good. And both your red reflexes were intact. And there we were assessing cranial nerves 2, 3, 4, and also 6. I'm now going to move on to your ears. I'm going to first look at alignment and placement of your ears. I want to make sure that everything is symmetrical. I'm then going to palpate your auricle and pinna and make sure there's no tenderness or pain and your auricle moves very freely. I'm next going to assess your hearing, cranial nerve number 8. But first, you're going to do the whisper test. I'm going to have you cover your right ear. I'm going to step behind you and whisper a word, and I want you to repeat it.
Cat.
Okay, good. I'm going to do the same thing with your left.
Apple.
Okay, very good. I'm now going to further assess your hearing by using my tuning fork. I'm going to first do what's called the Weber test, and I'm going to strike the tuning fork and place it on the top of your head. I want you to let me know if you hear the sound equally in both ears or better in one versus the other.
Equal.
Okay, very good. I'm next going to do the RENA test, and this is going to test for air conduction compared to bone conduction. I'm going to strike the tuning fork and place it behind your ear on your mastoid bone. You let me know when you can no longer hear the sound, and then I'm going to move it to in front of your ear, and again, let me know when you can no longer hear the sound.
Okay. Okay.
Okay, and we'll do the same thing for the other ear.
Okay. Okay.
Okay, and good. And the air conduction should be twice as long as bone conduction. I'm now going to move on to your ear canal and your tympanic membrane. And to assess those, I'm going to use my otoscope. I'm going to start over here. I'm going to pull your auricle up and back and then take a look inside your ear. Alright, good. Your ear canal looks good. There's no redness, drainage, or swelling. And your tympanic membrane is nice and pearly gray and translucent in appearance. And there was no bulging or fluid accumulation around your membrane. I'm going to do the same thing with the other ear. Again, I'm going to pull the auricle up and back. Okay, good. This ear canal also looked good. There was no drainage or redness or swelling. And that tympanic membrane was also pearly gray and translucent in appearance. Okay, I'm now going to move on to your nose. I'm first going to start by inspection. I'm looking at your nose. I'm making sure it's symmetrical, looking at the structure of your nose, making sure that your septum position looks to be midline. I'm then going to take my pen light and I'm going to look inside your nose. And I'm looking at your turbinates and mucosal, making sure they're nice and pink. I'm also, again, looking at your septum, making sure that it's nice and midline and it's no deviation. Okay, I'm going to assess the patency of your nostrils. I want you to close one side of your nose and take a deep breath in and out. Good. The other side, in and out. Very good. Okay, and your nose is patent bilaterally, which is good. That was cranial nerve number 1. I'm now going to move on to your mouth. I'm going to assess your mouth. I'm first going to look at your lips, making sure that it is that there's intact and moist, making sure that there are no dryness, there's no cracking to your lips. I'm again going to use my pen light and I'm going to look inside your mouth. Can you open your mouth for me? Good. And while in your mouth, I'm looking at your vocal mucosa, making sure they're nice and pink. I'm looking at your hard and your soft palate. Making sure that they look good, and they do. Lift up your tongue for me. I'm looking at the floor of your mouth, making sure that there are no lesions or abnormalities. I'm looking at your gums, making sure that I don't see any bleeding, which I don't. I'm also looking at your teeth. I'm looking at the number and color of your teeth and surface characteristics. If you'll stick out your tongue for me, good. I'm looking at your tongue characteristics. I'm making sure it's nice and smooth, symmetrical, with purposeful movements. If you'll say ah for me.
Ah.
Good. I'm also able to visualize your uvula, and I saw it rise symmetrically against your soft palate, as well as your tonsils and your posterior pharynx and your pillars all look good. I'm next going to assess your gag reflex. I'm going to use my tongue depressor and place my gag reflex in the posterior part of your mouth. Okay, good. And your gag reflex is nice and intact. And this was assessing cranial nerves 9, 10, and 12. Now I'm going to move on to your neck. Looking at your neck, I'm making sure that the skin looks good. There's no lesions or rashes or no masses on your neck. It's nice and smooth. I'm looking at your tracheal position. It looks to be midline. I'm making sure that I see no JVD on your neck. There's no thyroid enlargement. I'm now going to move on and palpate your carotid arteries. I'm going to do those one at a time. Good. I'm also making sure that your trachea is nice and midline. You'll swallow for me so I can assess your thyroid. Good. Your thyroid is nice and rolls nice and symmetrically. There's no enlargement. I'm next going to do some range of motion exercises. I want you to lift your head back and down and look side to side, and then lean your neck side to side. Okay. I want you to push on my hand. Good. Do it again this way, and front and back. Good. And shrug your shoulders for me. Good. And shrug against resistance. Good. And so that was looking at cranial nerve number 11. I'm now going to assess your lymph nodes. Okay, I'm going to palpate your lymph nodes. I'm going to start with the preauricle, postauricle, occipital, tonsillar, submental, submandibular, superficial cervical chain, posterior cervical, deep cervical, supraclavicular, intraclavicular, and I'm also going to assess your axillary under your arm. Okay? Axillary on this side under your arm. Good. I'm now going to auscultate your carotid arteries and your thyroid, making sure that I hear no bruits. And I'm going to do this with the bell of my stethoscope. Okay, very good. So I didn't hear any bruits or anything with either carotid artery or your thyroid. I'm now going to move down to your upper extremities. I'm going to first inspect and palpate your shoulders and then your arms and your hands. I'm looking at your skin. I'm looking for color uniformity. I'm making sure that there's no rashes, there's no lesions. Your skin feels nice and warm. And there's even distribution on your arms. I'm going to move on to your hands. I'm looking at your skin here, nice and uniform. Your cap refills less than 3 seconds. Your nail characteristics are nice and smooth with no ridges or anything. I'm then going to palpate your radial arteries. Turn your hands over. Good, and your radial arteries are nice and strong bilaterally. Now your brachials. Good, and they're also nice and strong bilaterally. I'm now going to move on to your back and posterior chest. If you'll turn for me. Good, and first I'm going to start with inspection of your back. And if you didn't have a gown on, I could easily visualize the skin on your back. And I can also, looking at your thoracic configuration and your spine, and everything is nice and symmetrical. I am then going to palpate your costovertebral angle, and you let me know if there's any pain or tenderness here. Okay, feel okay?
Mm-hmm.
Good, and now I'm going to percuss your costovertebral angle. Good. Any pain or tenderness? Good. If there was too, that could be indicative of maybe some pyelonephritis. I'm now going to move on to your lungs. I'm first going to inspect respirations. I'm going to be sure that they're nice and even, and there's no labored breathing. I'm then going to go and palpate for an expansion. Take a deep breath in for me. Out. Good. Again. Good. And as you inhale and exhale, my hands move evenly with your chest. There was nice even chest rise and fall. I'm also next going to move on to your tactile firmness. I want you to say 99 when you feel my hand touch your back.
99, 99, 99.
Okay, very good. I'm now going to move on to percuss. The first thing I'm going to do is percuss for your diaphragmatic excursion. All right. I'm going to have you take a deep breath in, and when you let it out, I want you to hold it. Okay, good. And then I make a mark right here, and I want you to, this time I want you to, when you take a deep breath in, I want you to hold it. So deep breath in. Okay, good. And what I would do is I have my 2 lines here, and I take my tape measure out, and I measure in between the lines, which is about 4 centimeters, which is normal. Normal would be 3 to 5. I'm now going to percuss your posterior and lateral chest. Good, there was good resonance throughout. I'm now going to auscultate your posterior and lateral chest. Deep breaths for me. Okay, very good. And those are your breath sounds were nice and clear bilaterally. Okay, you can now turn for me, and I'm going to assess your anterior chest. I'm first going to inspect, looking at your skin and making sure that there are no lesions and rashes. I'm making sure that everything, your chest appears to be symmetrical. I'm also looking at your respirations, making sure that, again, that they're nice and even. I'm looking at your respiratory effort, making sure that it's nice and unlabored. There's no labored breathing. And I'm also looking to be sure I don't see any pulsations or heaves, and I don't. I'm now going to move on to palpate your chest. And again, I want you to let me know if there's any tenderness here. Tenderness?
No.
Good. And I'm now going to palpate your precordium, making sure I don't feel any thrills, heaves, or pulsations in your pericordium. Good. I'm next going to palpate for your apical impulse. Good. As well as assess tactile firmness on your anterior portion of the chest. Okay? Say 99 for me.
99, 99, 99, 99.
Okay, very good. I'm now going to percuss. I'm going to percuss very systematically, and I'm going to compare both sides again. Okay, good. And there was nice resonance throughout your chest. I'm now going to take a listen to your chest. All right, I'm going to listen to your breath sounds. Deep breath. Good again. All right, good. So we listened and compared both sides, and your breath sounds again were nice and clear auscultation. There was no adventitious breath sound. I didn't hear any rails, crackles, or bronchi. I'm now going to assess your heart sounds. Starting with your aortic, and then your pulmonic, Erb's point, tricuspid, and then mitral. Good. All right. S1 and S2 were both normal. There was no gallops, rubs, or murmurs detected. All right. And now I'm going to move on to your abdomen. Okay. I'm going to have you lay back for me. And first, while you lay back, I'm noticing the ease in which you were able to lay back, letting me know that you had good muscle tone in your belly, in your abdomen. I'm now going to lift your shirt just a little bit, just to View your abdomen. So I'm looking at the characteristics of your abdomen. I'm looking at the skin on your abdomen, making sure it's nice and even, making sure they're looking for any pulsations, movements, or contour of your abdomen. I'm then going to listen to your breath sounds. I'm going to start with your right quadrant and listen in all 4 quadrants. Good. Nice active bowel sounds in all 4 quadrants. I'm next going to listen to your arteries. I'm going to start with your aorta. And then your renal. Iliac. And femoral. Good. I didn't hear any bruits noted in your arteries. I'm now going to percuss your abdomen, okay? And I want you to let me know at any time while I'm feeling on your abdomen if there's any tenderness or pain. Okay, on the left side, I'm noting dullness over your spleen. On the right side, I'm noting some dullness over your liver. All right, good. I'm next going to move on to some light palpation. Again, let me know if any of this is tender or painful when I palpate your abdomen. Okay, feel okay? All right, very good. I'm now going to move on to deep palpation, okay? Some deep breaths in and out for me. Good. Okay, deep breath in and out. Good. And I'm over here on the left side feeling for your the spleen, which I don't feel, but a lot of times it is hard to feel your spleen. I'm going to move over to your right side and feel your liver. Deep breath in and out. Good. I'm feeling for the right costal margin of your liver, which I feel it's nice and firm. I'm then going to move on to palpate for your kidneys. Good. The other side for your other kidney. Good. I'm also going to go midline and feel for your any aortic pulsations. All right. Good. Next, I'm just going to have you lift your head for me. Again, I'm looking at your muscle tone and strength of your abdominal muscles, which is very good. I'm now going to move down to your legs. I'm looking first, going to inspect your skin, making sure I don't see any abnormalities to your skin. There are no rashes. There are no lesions noted to your skin. Your hair is shaved. Otherwise, I would assess for even hair distribution to your legs. I'm now going to palpate your legs, and I'm feeling for the temperature of your legs, making sure that they're nice and warm, which they are. I'm also going to palpate for any edema. Okay, and there's no edema present. I'm going to move on to palpate for your pulses. I'm going to start with your popliteal pulse. Good, and then I'm going to move to your posterior tibialis, and then your dorsalis pedis. Good, and all your pulses were equal and +2 bilaterally. I'm also noted that your muscle tone in your leg is nice and strong. I can tell you have really good muscle mass in your legs. Okay, I'm going to have you sit up for me. All right, we're next going to move on to the musculoskeletal portion of the assessment. And to assess that, I'm going to use my reflex hammer. And I'm first going to start by assessing your reflexes, starting with your brachial. And then your other side. Good. I'm next going to move on to your knee or your patellar. Okay, good. And then we're going to move down to your Achilles tendon. Okay, good. And all your reflexes were nice and intact. I'm next going to do your muscle strength. I want you to extend your arms straight out. All right, don't let me push your arms down. And don't let me pull them up. Good, all right. You have nice, good muscle strength. I'm going to have you step down for me. Good. And I'm next going to assess your spine, your cervical and lumbar spine. I want you to just bend straight over. Good. And as you bend over, I notice the ease in which you were able to bend over. I'm also looking at your spine, and I don't see any curves of your spine. It's nice and straight. And I'm going to walk my fingers up your spine. I don't feel any lumps or bumps in your spine. Is this painful at all?
Yeah.
And it's not painful, which is very good. Okay, and you can stand up for me. All right, and as far as the neurological exam, so we assessed your cranial nerves as we went through the assessment as well as sensation. You're alert, you're oriented. You answered all my questions appropriately. And at the end of the exam, if we found any abnormal findings, we would discuss those and we would talk about any possible treatment or referrals that need to be made. Otherwise, this concludes my video. Thanks for watching.